Thanks for the possibility to participate in this webinar and also for your support in this campaign to support Cuba with these pacemakers. To talk about the achievement of the national health system, previously we need to make a brief comparison of what we had at the beginning of the triumph of the revolution and what we have now. In 1959, we had almost 6,286 doctors. Most of them are located in the large city, the main capital of the province, and dedicated to private practice. And an exodus of the 50% of them occurred at the beginning of the years. It means that we had on that time only 3,000 doctors for a population of around 9 million of persons. The infant mortality was higher than 60 per 1,000 live births, life expectancy lower than 60 years, and sanitary hygiene situation was mostly related with communicable diseases, many of them preventable with a vaccine program. Our illiterate population represented on that time the 40% of the population, and we had only one school of medicine for the whole island. At the end of last year, we can say that we have more than 94,000 of medical doctors. That represents around the 84.9 doctors per 10,000 inhabitants. We can cover with that the 100% of our country, even in rural and difficult access areas, we have at least one doctor and one nurse. Infant mortality was 7.1 per 1,000 live births. We need to highlight that previously to the pandemic, our infant mortality was during the previous 10 years between 4 and 5. Life expectancy is now 78 or 45, and in case of women, is around 80. Sanitary hygiene situation now is mostly related with non-communicable diseases. And we have one immunization program that covers 13 diseases with 11 vaccines. 8 of them are produced in Cuba by our biotech industry. According to the latest data published by UNESCO, our literacy rate is now 99.75%. And we have now 13 medical universities, 29 faculties of medicine, the Latin American School of Medicine, and the National School of Public Health. According to the principle of the national health system, we can say that is universal, it's free of charge at all levels. It means that from the entry level, that is primary health care, or if a patient needs a liver transplant or an implant of a pacemaker, for example, in one of our research institutes, is available, provide a comprehensive care, and it has a strong internationalist conception with community and intersectorial participation. According to the budget, we need to say that the government allocates to public health and social assistance the 27% of the state budget. If we add the 24% that is allocated for education, we can say that 50% of the budget is for health and education. That represents around the 11% of the GDP. Previously, I mentioned as one of the international achievement, and our international cooperation as a principle of the national health system, that it has more than 60 years. It started in 1963 in Algeria when we sent the first medical team. And currently we are in more than 54 countries, in 54 countries with more than 22,000 of health professionals. During this period, we have provided service in 165 countries with more than 605 health workers. A special mention needs the Henry Reef Medical Brigade that was created in 2005 when Hurricane Katrina hits New Orleans, and our Commander-in-Chief Fidel Castro created that medical team specialized in natural disaster and serious epidemics. And from that time, 89 medical teams has been sent to 55 countries with more than 13,000 of health workers. 3 of these brigades face Ebola in Western Africa with more than 260 professionals. And during COVID time, we sent more than 5,000 of health workers in 58 medical teams to 42 different countries. These are some of the achievements of the national health system, but we have serious challenges in the national health system, such as the aging of the Cuban population. Now it's more than 20.3% of our population. It means that 20.3% of our population have more than 60 years old. Related also with diminished natality and fertility. Our fertility rate is around 1.2 per couple. The increase of non-communicable diseases like and antimicrobial resistance like worldwide. Climate change, and we are seriously affected as we are an island. Research and technological innovation. The high cost of new technologies and the economic financial blockade imposed unilaterally by the United States. Related with that, we can say that we have more than 60 years under an imposed economic, commercial and financial blockade by the government of the United States. Only to mention one period from March 2022 to March 2023, the negative health impact is more than $239 million, and the accumulated impact is more than $3 billion in health sector. During Trump administration, 233 measures were imposed and remaining unchanged through the Biden administration, even applied with more efficiencies than even during Trump administration. Also, the inclusion of Cuba in the blacklist or the spurious list of countries that sponsor terrorists, limited access to credit, bank loans, to access to normal trade with most of the country, and unparalleled intensification of the economic and financial and commercial blockade has been applied since that measure was imposed. There is an international rejection, almost unanimous. Only mentioned the last year at the UN General Assembly, 187 countries support to lift the blockade. The blockade caused impossibility in acquiring medical technologies from the United States or even from different countries if that medical devices, for example, have more than 10% of a spare part of component from the United States. That forced us to search in this market, and sometimes through intermediaries, medicine, equipment, medical devices, region, raw material, for the manufacture of medicine and other supplies that we use in our medical care. That also increased the price for its acquisition and transportation from distant market. It has, of course, a major economic impact. Financial limitation, the increase of the pressure from the United States on international bank to limit our economic transaction, real difficulties for the sustainability of the national health system, because that incomes we need also to support that medical system that is free, but it has a high cost for sustain to the medical sector. It has a negative impact because there is a non-availability of necessary medication, lack of spare part for medical and non-medical equipment, and that have a very negative impact in health and quality of life indicator of the Cuban population as individual, in the family, and also in the community that they live. We need also to highlight the period of the pandemic, COVID-19, when we have no possibility of acquiring lung ventilators at the time of greatest demand during the COVID-19 pandemic. There was no possibility of acquiring medical oxygen or even a spare part from the United States to repair the oxygen production plant that we need to repair during that period of time. There was even no possibility of acquiring medical supplies or raw material, okay, that is really necessary for the industrial scaling during the production of the Cuban vaccine against the SARS-CoV-2. What is the major impact, or what is the proposal with that blockade? As our president, Miguel Díaz-Canel Bermúdez, he said that the purpose is economically suffocate the population, so that the population, due to economic suffocation, due to the discomfort that it causes, has a rupture that causes a social outbreak, and the final result will be the Revolution 4. And we need to say that that all of these limitations have a negative impact in the life of all Cuban citizens. Can you imagine how much we could do, and we can advance in the development of the country if we had been able to have resources during all this time? That's why we need to say that it's better without blockade.